Let's talk child therapy for a moment. Child therapy is something that my clinic, Toronto Family Therapy, highly specializes in. We have wonderful child-centered therapists who work with children so nicely and so supportively. So I really want to take some time and talk about child therapy because people call in and they inquire about child therapy, but I don't think they have enough information about how it works and the process and what children should expect. So, generally, having worked with children in therapy for years, children have no idea what to expect. They don't know what they want to get out of therapy, and they're very ambivalent often when they first begin therapy. It's very rare for a child to wake up in the morning and say, hey, I want to go talk about my feelings and resolve my conflicts. They don't know how to do that yet. So child therapy is an essential skill that they learn as they work with their therapist. The first thing that children rely on when entering the process of therapy is that they rely on their parents to be fully encouraging, open, and supportive of the child therapy process. Parents need to speak to their children about therapy and make sure it's brought up in a positive light, not like a punishment, not like a daunting medical appointment. It's a positive way to learn how to manage your problems and talk about your feelings. So it first comes from the parents' discussion with the children about child therapy. Therapy can be wonderful, rewarding, and an educational experience for children. They can learn to express themselves, articulate how they're feeling, communicate, problem solve, find resolutions to their problems, and manage stress and become resilient. Learning how to manage stress these days is so important, and children need to learn the skills. They need to recognize their triggers. They need to understand when they're feeling upset, and generally, they need to understand themselves better and feel more connected with their family, their friends, their peers, their school. A variety of clinical approaches can be used in child therapy to achieve those goals. And here at Toronto Family Therapy, we offer so many different styles of child therapy to match the needs of the child, such as play therapy, drama therapy, cognitive behavioral therapy, a hybrid of them all, or talk therapy. We are often so focused on how to teach children how to learn, how to read, how to write, how to do arithmetic. We also have to teach them how to feel, talk about their emotions, and control their thoughts. Overall, it can help them learn how to better manage their emotions, cope with changes, and develop positive relationships and communication skills. We are so fortunate at Toronto Family Therapy to have a number of dedicated child therapists on our team who are trained, child-focused, enthusiastic, and happy to work with children. I'm going to talk today a little bit about our child therapy intake process because I think that that's a good place to start. So the first step is to call into Toronto Family Therapy and learn a little bit about our services and book an intake appointment. Now, the intake appointment is always with the parents because it's important for the therapist to really gather background information about the children. They want to understand, lots of things about the children that they're about to see in their therapy session. So the therapist is going to ask a lot of questions. For example, the following topics may be explored, such as what is the problem? What is the concern? Why are you here to get some therapy for your child? What is their family life like? What is their school life like and their academic performance? Are the parents willing and supportive of the family therapy process? We want to know about health issues. Have there been stressors or losses in their lives? Do they have any health issues? Have they been faced with any mental health issues such as anxiety or depression? Are they having difficulty with their peers? Are they causing conflict in the home? So we ask all sorts of questions to learn about your child and develop, the appropriate therapeutic treatment for your child. We want to learn if they've previously seen a counselor and how that experience has been for them. The therapists will prepare parents on how to discuss child therapy with their children, so the parents have confidence to tell the children about the therapy process. That's the first step. The second step is an introduction session where the therapist meets the parent and the child together. And that's when the parent introduces the therapist to the child. And it's just a very light, easy flowing introduction session.